Good afternoon. Today I'll be showing you how to put in various types of appointments in the appointment book in Medical Director Praxsoft. So to go to the appointment books, we go to this icon here, appointment book. My view is currently set up as a day view, so I can see that it's Thursday the 12th of August 2021 and I have both my practitioners present. I could change the view to go a week view, to switch to week view, and then I would need to just select which practitioner that I needed to do if I was working on an individual appointment book for either of the practitioners. So I'm just going to switch back to day view and demonstrate a few ways to put in appointments. So these grayed out sections are non-session time slots, so appointments that have been times that have been grayed out because the doctor possibly wouldn't start until 8:06 and not ready to start taking patients until 8:06. And then with Dr. AP, he is not going to start taking patients till 9:06. So to create appointments for a patient, it's as simple as typing in their surname. So I'm just going to start typing in the surname and for a surname for a patient with the surname Andrews, and then I'm going to hit enter. I'm just going to choose Anna and double click. And then Anna has now been booked in for an appointment with Dr. I Feel Good. So I've just done that. I'll do another example down here, and this time I'm going to just start typing in Andrews again, and this time I'm going to put Heather in, and she's going to be in this one. Now, if you get this pop-up, this is a recall message. So if the patient has got a reminder notice to attend to an influenza vaccine or a pap smear or any other medical follow-ups needed by the practitioner, it'll come up there. So if you know that this appointment is for an influenza vaccine, you could tick the box. If you're not sure, you could just go, just select OK. So that's Heather. To do long appointments, you would select the number of cells that you require the appointment to go over. And I'll type in Andrews. This time I will choose John Andrews. And now I've got outstanding account details. So there is fees outstanding, which I could follow up with John when he came into the practice. So it's a reminder that he's got $39.80 due, and I'm just going to close that. So at 10:30, Dr. AP likes to have his morning tea. So I can schedule morning tea for the doctors and block out those times so that he doesn't get appointments while he's on his morning tea break. So I've just selected 3 cells, and what I will start doing is start typing morning tea. And then I'm going to hold down the control key and press enter. And then you can see that it's grayed out. I can do the same for Dr. I Feel Good. At 12:06, I'm going to block him out for an hour for lunch. Then just selecting the cells and start typing, and then control enter. At 2:06, I'm going to make a meeting for Dr. IF. So I'm just going to select the cells that I need. So from 2:06 to 12:30, and I'm going to just write pharma rep meeting and then control enter. Now I can also set reserved appointments. So a reserved appointment is essentially a time slot during the day the practitioner is required to keep spare. They can either be cleared at the beginning of the day or kept for patients requiring an emergency appointment. So I will locate the time that I want to add a reserved appointment, and then using right-clicking, getting this pop-up menu, add reserved appointment. Then I can put in my options. So making sure that it is for the correct practitioner. If it's not, you can use the drop-down box to change it. And then you select your options. So your from date and your to date. So a start date and an end date for the period of reserved appointments. Indicate the pattern and time of how often you wish to the appointments to reoccur. So you could do every 4th hour by putting 4th and then using the drop down box and go hour. You could do every 2nd day or every 4th day, every 4 weeks, every month, or every 1 year. So I'm just going to do every 1 year process. And then I've got this option that comes up, and it's for 10:42 on the 12th of August. Now, I can already see that it's been put in there, so I just need to close it. If I wanted to go back and delete it, I could just delete and then put in my reason why. But for this example, I'm not going to delete it. So now I have reserved appointments. Reserved appointments, morning tea, lunch, and a pharma rep meeting. So if a patient calls up wanting an appointment and they have not visited the surgery before, you can tentatively book them into Praxoft. To do that, you would just start typing their surname. So for this example, I'm going to do Jones. So there is no patients. Because I've ticked this box over here, including everyone, I know there's no patients in my database with the surname Jones. So I'm going to enter just his first name, so Anthony, and I'm going to put his date of birth in because I would have got that information over the phone, and any other details that I've obtained on the phone. And then I'm going to go create patient. So you can see Anthony Jones is now in. He's booked, got this little red mark next to him, which indicates he's not a patient. So that's going to flag us when we go and put him in. When he comes and visits later, we're going to know that we need to get a patient registration form of him. So another thing you can do in Praxoft is you can, if you know some of the reasons why your patients are attending for their appointments, you can assign little icons to them. So for John Andrews, he's got a long appointment. I will right click on him and then I can go to type. And I'm going to say that because he's got a long appointment, I'm going to say that it's a procedure. Then you'll see next to his name, there's a little icon of some scissors. With Heather Andrews, again, you just right click, go down to type, and for this appointment, I'm just going to put vaccination. It is not necessary to put in these little icons. However, double check with the practice that you work at if there is a policy regarding appointment types and assigning appointment types to patients in the appointment book. So I hope this helps with setting appointments in Praxsoft.